In the labyrinth of the mind, the shadows of past and present entwine, perpetually reshaping the landscape of consciousness. The STAR trial addresses the considerable overlap between psychosis and post-traumatic stress disorder, conditions known for their complex interplay and challenging prognosis. This UK-based multicentre, randomised controlled trial involved secondary care patients with both disorders. 305 adults, primarily white, with a mean age of 38.9 years, were randomly assigned to either trauma-focused cognitive behavioural therapy for psychosis, CBTp, combined with standard care or standard care alone. The intervention involved 9 months of personalised trauma-focused CBTp. The primary endpoint was the change in PTSD symptom severity, evaluated at 4 and 9 months using the clinician-administered PTSD scale.
Quick take. STAR trial tested an integrated therapy for people with both PTSD and psychosis, comparing trauma-focused CBTP with standard care in over 300 patients across the UK.
Significant reductions in PTSD symptom severity were observed, with an adjusted mean difference of negative 8.67 in CAPS-5 scores favoring trauma-focused CBTP. Secondary outcomes showed improvements in 81% of measures, including core PTSD symptoms, psychotic experiences, and mood disorders. However, no significant change was seen in vocal hallucinations, referential beliefs, or social functioning. The authors conclude that trauma-focused CBTP is effective, safe, and highly acceptable for treating PTSD in patients with psychosis, advocating for its inclusion in standard care for this complex patient population.
Quick take. The trial demonstrated significant PTSD symptom reduction with trauma-focused CBTP in psychosis, though some symptoms like hallucinations showed no change.
Short quiz, clinical vignette. Question. A 39-year-old female patient presents with co-occurring psychosis and PTSD. Her initial CAPS-5 score is high, indicating severe PTSD symptoms. Which treatment approach is associated with the highest likelihood of achieving PTSD remission based on recent trial data? Option number 1 is standard care alone. Option number 2 is cognitive behavioral therapy for psychosis, CBTP, without trauma focus. Option number 3 is trauma-focused cognitive behavioral therapy for psychosis, CBTP, plus standard care. Option number 4 is medication-only management.
The answer is option 3. The STAR trial concluded that trauma-focused CBTP integrated with standard care resulted in significantly higher PTSD remission rates than standard care alone.